Hello, and thank you for taking the time to watch this video. The Durham County Sheriff's Office and the Department of Criminal Justice at North Carolina Central University have established a partnership with the goal of gaining a better understanding of your health and wellness needs as DCSO employees. As you may know, working in a criminal justice organization can be very stressful. Researchers have spent years studying stress among employees working in criminal justice organizations, and what they found is that both civilians and sworn personnel are confronted with many types of stressors, such as occupational stressors, organizational stressors, and personal stressors. Some examples of occupational stressors are employees' interactions with the public, work schedules, experiencing traumatic events, and sustaining physical injuries. Stress can also stem from organizational factors such as constraints on career mobility, administrative interactions, and bureaucratic red tape. And of course, employees are faced with personal stressors, such as their health histories and family responsibilities. Researchers have found that stress can have serious consequences to one's health and wellness. Stress can lead to an increased likelihood of sustaining physical injuries, anxiety, depression, suicidal thought, and more. In fact, law enforcement officer deaths have been linked to alcohol and drug use. Further, studies have found that law enforcement officers are more likely than the general population to experience post traumatic stress. Not to mention that law enforcement officers are also at higher risk for suicide than any other profession. The limited amount of research that has been conducted on civilian employees have found they experience similar levels of stress, and, depending on their position within the organization, can experience even higher levels of stress as compared to sworn personnel. The consequences of stress, anxiety, depression, and trauma can be devastating to the personal and professional lives of individuals in the public safety community. They can also be detrimental to morale, retention, and operational effectiveness in public safety organizations. Thus, the goal is to find ways to prevent or mitigate these potential consequences before they manifest into life-threatening and or career-threatening situations. To address this issue, some law enforcement agencies across the United States are developing or expanding structured peer support programs that are specifically geared towards promoting officer wellness. Peer support programs are most common among larger agencies with more than 100 full time sworn personnel. More specifically, 56% of large agencies, approximately 19% of medium agencies, and 7% of small agencies have a peer support team to assist officers as needed. So, what is a peer support program? The purpose of a peer support program is to promote officer safety and wellness by providing emotional, social, and practical support to anyone working in the organization. Designated peer supporters are usually volunteers who are specifically trained to support their peers. They are neither counselors nor therapists. Instead, their main responsibilities are to listen, assess, and refer individuals to professional and other resources as needed. Research on the impact of peer support programs on officer wellness is ongoing. A recent study revealed that peer support helps enhance mental health literacy while also reducing mental health stigma. As members of the Durham County Sheriff's Office, we recognize the importance of promoting your health and your safety. Given its potential to enhance the wellness of individuals working in criminal justice organizations, it would be extremely important to determine whether a peer support program modeled around the needs and concerns of the Durham County Sheriff's Office would be beneficial to its members. In the upcoming weeks, you will be receiving an invitation to participate in a confidential online survey. Once again, this survey will be completely confidential. The partnership between the DCSO and the NCCU research team explicitly prohibits the sharing of individual responses or any information that identifies a particular employee. In other words, only members of the NCCU research team will have access to survey responses, and we are bound by our confidentiality agreement. We will not identify who did or did not participate in the survey. We will only report statistics on overall participation. Findings from the studies will be reported in the aggregate, which means that no references will be made to any specific individuals. Overall, your responses to the survey will provide us with valuable insights into your needs as DCSO employees, as well as whether a peer support program would be beneficial to you as members of the Office of the Sheriff. In other words, completing the survey will allow your voices to be heard. To provide you with a preview, here are just some examples of the types of questions you should expect to encounter on the survey. For instance, you will be asked to provide information about your background, such as your marital status and highest level of education. You will also be asked questions pertaining to your health, how you respond to stress, your views on organizational support, stigma related to mental health, and more. You will see questions that are likely to be considered sensitive or personal information, questions that you may consider to be outside of the workplace. Please trust that this assessment is evidence based and supported through research on officer wellness and health. Evidence based approaches have been used to guide programming and funding decisions in other agencies and jurisdictions. To maximize the effectiveness of this assessment, we encourage you to provide honest and candid responses. The information that you provide will potentially help in the development of programmatic responses that will be beneficial to you and your peers in the DCSO and in the criminal justice community. The time that you spend participating in this assessment will be time spent on the health and wellness of the DCSO and the field. To summarize, this assessment will gather baseline data and information on some of the health and wellness concerns among DCSO employees. Information gathered from this assessment will inform the development of health and wellness programming specific to the DCSO. In addition to programming that is currently available, information will be gathered to assess the potential for a peer support program for the DCSO. Should you have any questions, please feel free to contact any member of the research team. We appreciate and respect the important and challenging work that you do, and we thank you in advance for your participation in this health and wellness assessment. We look forward to hearing your voices, your needs, and concerns.